welcome to all of you. Thank you very much to the international chapters for the opportunity to talk with you today about immersive reality for health. On the screen in front of you, you see our beautiful National Library of Medicine buildings at the National Institutes of Health. We've been part of the National Institutes of Health for over 50 years, but this is the first time a nurse has led the National Library of Medicine. You can well imagine that some of my colleagues were pretty nervous when they saw this nurse coming in. What you heard in the presentation of the various chapter activities brings forward the power of nursing and why it matters to have a nurse thinker as the head of the National Library of Medicine. Now, I'm also a nurse researcher, and I do research using virtual reality. So I'll be describing a little bit about my research program, some of the challenges we've experienced in that, and also talk to you a little bit about the National Library of Medicine. As was indicated earlier, I have no personal disclosures, and the opinions that I am presenting are my own, not part of the United States government, and I work towards reducing any types of stereotypical thinking in my presentation about patients, nurses, or our healthcare provider colleagues. Watch this video with me to see the future that I think we're moving towards. Please know that the National Library of Medicine is a partner in the use of advanced technologies and advanced information tools for health. Importantly, we'll be talking today about virtual reality, advanced visualization, but it's getting harder and harder to separate advanced visualization from artificial intelligence and in the advanced analytics that make these visualizations possible. I'll try to keep it clear so we can learn from this. But I want to begin by something well familiar to nurses, and that is this need to begin from objectives. What will we be doing to address the needs for the future through these virtual reality platforms, specifically as nurses? And we have to address some new challenges, address some new measurement and methodological changes that make a difference when you're using a virtual environment as opposed to a physical environment. Let's begin, though, by thinking about nursing care. The line in front of you depicts a year in the life of a person. This person may have had a fracture, goes through surgery. The second image has recovery and then is discharged, perhaps with the medication, goes for follow-up care, and continues to be appraised to the health system. This is a very typical journey for nursing. But what we know, most importantly, is the technologies that have been available to nurses often address only those thin little lines across the trajectory. Our goal, the goal of my research, and frankly, the goal of my whole operation at the NLM, is to go to the care between the care, the white spaces, so we can bring information, knowledge, and technologies into the places where people live, work, and play. Now, our usual attempts for doing that is through interpersonal strategies in nursing. Our usual research studies biological, physiological, and psychological experiences with patients. Today, I'm going to be talking to you about virtual reality. But I'd like to spend a little time with you discussing what virtual reality is and what it is not. Virtual reality is a term that has been around actually for almost 40 years. It refers to any use of technology to mimic the sensory and behavioral cues of the real world. Some of you may have experienced Second Life, a computer platform that was popular about 20 years ago that allowed individuals looking at a computer screen to pick an avatar, a computer-generated image that depicted them, and moved through various environments, maybe for learning. Maybe some of you even attended a virtual poster session, which was very popular in nursing at the time. The virtual reality I'm going to be talking to you about today is the immersive virtual reality, the use of computer technologies to create experiences as if being there in an environment where the cues are actually computer generated. You see on the very far left, a computer interaction with a nurse and a patient. That's not really what I'm meaning when I'm talking about virtual reality. I'm talking now about the use of visual cueing that doesn't really exist in the world and provides a predictive stimuli to a patient. For example, in the left-hand screen, you see a young man looking at a container of orange juice, and the nutrition information about that orange juice hovers over that. This is a vision of what assistive augmentation or assistive reality might appear in the future to help us make better choices in the moment. In the middle screen, you see a scientist looking at a a biological structure. What the scientist is visualizing is actually seen through that large head-mounted device around the scientist, but what you see depicted on the screen is what the scientist is seeing. Importantly, her hand gestures are moving the scene in front of her. So we have interaction not only visually, but also by gesture. In the lower right-hand screen, you see a young man in a city, but overlaying the city are particular indicators or markers that suggest this is a building, this is a restaurant, this is where you can go to get some clothing. Those opportunities to overlay reality with virtual reality are becoming popular as ways to help guide people through everyday living. So you see what distinguishes virtual reality, immersive virtual reality today is the use of a special device to visualize the experience, the environment, with seeing things that are not physically present in the environment, but created by the virtual images. At the Advanced Visualization Laboratory at the National Institute of Nursing Research at the National Institutes of Health, we are focusing on creating experimental virtual environments to explore self-management behaviors in context. On the right-hand side, you see the members of my team. We have a multidisciplinary team, including nurses, engineers, computer scientists, behavioral scientists. Our contribution to nursing knowledge arises because we are focusing on understanding health in the context of a person's everyday living and their lives. And our virtual environment allows us to create the context within which we can help understand health behaviors. Our work at the National Institutes of Nursing Research focuses on accelerating the use of advanced visualization. To be quite honest, I'm just curious about where immersive VR is going to take nursing and what we can do with it that we might not have thought about before. So we partner across the campus to evaluate ways that can advance our research. Right now, we're working on a partnership with a symphony conductor, envisioning how a virtual orchestra might allow a symphony a new conductor the opportunity to practice, but allow our team the opportunity to understand gesture-based interaction. So we have very interesting partnerships. Our first challenge that we took on is to imagine how immersive virtual reality, or IVR, could understand and it could help advance nursing's understanding of managing health in everyday living. Now, in order to understand which health problems were the most important, we impaneled a group of home care nurses, and we asked them, what kind of challenges do people experience at home? And what we learned is there are three key challenges. There are many, many challenges, but there are three that come up the most often. First was diet management. How do I pick a diet that adheres to either the restrictions or the foods that are most necessary for me to stay healthy? Second, medication management. How do I know how to take my medications, particularly if I need to alter the schedules from day to day, or maybe take certain medications only as needed? And third, equipment management. How do I handle a respirator, or how do I handle a CPAP machine? How do I self-administer an injection to myself? Understanding how to do all of these in the context of somebody's everyday living is the challenge we took on. Think about households for a minute. We need to understand, where does better understanding of the environment really need to happen? Where does it matter? Envision your bathroom at home for a minute, or your kitchen. Where do you keep medications? How do you remember what dietary guidance you're supposed to follow? We also needed to understand what could we study in immersive virtual reality and what could we not study. Right now, immersive virtual reality is best for gross motor activities. Fine motor activities, such as picking out a pill from a pill bottle and putting it into a pill sorter, are much harder to manage in a virtual environment. We can talk about those in the Q&A session if you want. So we took on the challenge of managing diets, and we created a virtual grocery store, the AVB Mart. This is an entire visualization that you are seeing on the screen now. And we use this immersive space to walk research participants through the process of picking foods for a week or a day or a meal in a grocery. We're presenting health information in the moment, in the context, that is in the grocery store where the individual is practicing how they establish and choose foods for their diet. What's important about this, and you'll see in our next video, is we want to give people the experience that is pretty similar to actually being in a grocery store environment. Now, some of you may immediately say, well, wait, that doesn't look like the grocery store in my neighborhood. It's less crowded. There's no people in it. There's different kinds of foodstuffs. The advantage of virtual reality is we can tailor to the local environment where our studies are being conducted. Take a minute and watch this video with me. I'm going to talk you through what we do in environments, and then we'll go into some more depth about the study. So here you see how we assess responses to questionnaires. We give the individual an experience, prompt them with a question. Now, aisle. You can't walk in our VR, but you can teleport. So we have a wand that allows you to press forward, leading up to the area in the store where you'd like to purchase or like to select an object that is appropriate for your meal. As you start to select, you use the wand to point to items on the shelf, and those items in turn will appear in a description window that comes in front of you, as you're seeing coming on the screen right now. The participant is prompted to say, what do you want to do? Do you want to buy? Do you want to compare this with other things? Remember, we give people a dietary food challenge so that these questions allow them to mimic their actual behavior. How do I choose a low sodium alternative? How do I put together a nutritious meal with low calories? This is what our grocery store currently looks like from above. You see across the top 7 or 8 aisles of foodstuffs. On the right-hand side, you see what would be a typical produce station. At the end, you see cashier stations, and you also see sitting areas common in U.S. grocery stores right now. We see foods being offered, snack bars being available. So you see there's sitting areas up front. I need to pause for a minute and say, I am not able to see any of the chat. So if there's a concern about my speaking, could someone come off mute and let me know what it is, please? Our grocery store is created in the Unity platform. This is a commercial platform that provides us with a number of tools so we don't have to construct every single object. It also brings into our environments the kind of physics you need to have to make the world believable. So an individual can't walk through a series of shelves, or an object, when it's picked up, stays intact. In the beginning of our studies in VR, we actually had some problems in this area, including picking up a bottle of pills and forgetting that the pills had to come along with the bottle. So a virtual bottle of pills would move, but the actual virtual pills stayed on the shelf. It wasn't very helpful. In our environment, we want to make the space as real as possible. So we've added avatars to the environment. Some of these avatars move and some of them do not move, but they make an individual feel as greater presence, feel as if they are in the environmental space that they expect. We also use avatars, we also use objects rather, to create obstructions to make the space again feel more real. We're going to talk a little bit about how real do you have to make a virtual environment to make sure it's actually really useful to what you want to be studying. Now, in creating our immersive virtual environment and measuring performance, we faced a number of challenges, and I'm going to go through 4 key challenges that we're facing. The first one is the requirements definition. Any of you who've worked in information technology design know that you begin every situation by defining the requirements, what problem matters, and what do we have to do to manage that problem. Our focus groups helped us with that. Diet and medication management were the two important ones, as I indicated earlier. Second, we had to think about, as nurses, what are the challenges in carrying out instrumental activities of daily living? And we know while there are many, there are two that particularly challenge our patients while at home. The first one is the remembering clinical advice and applying it to everyday living. So when a clinician tells you that you should follow a low sodium diet, does that mean you should take the salt shaker off the table, or does that mean you should start consulting the sodium information on the food labels? The challenge of changing from a recommendation to go to a low sodium diet to actually figuring out how to put together meals when food packaging is not the same size as an everyday meal really does take the individual in the food store and places them under kind of a cognitive strain. So we want to also look at cognitive fatigue. Are people exhausted by all of this mental mathematics that they have to do, figuring out if there's 4 servings in a case and each serving has 80 milligrams of sodium, how many servings can I have in a day, et cetera. We also know that cognitive fatigue can be induced by too much visual stimulation. So think about going to a noisy, crowded grocery store. We also know auditory stimulation and auditory distractions can make it difficult for people to carry out these activities. So our environment allows us to mimic both the mental challenges of planning and acquiring proper food for managing your diet, as well as the immersed experience, the noise, the distraction, the other aspects. We created 2 environments in our studies. The grocery store is the one we're speaking of today. We also have created a home environment. If you come to visit us or come to our website, you can see more about that. We've been testing feasibility and performance. There are many challenges to conducting a study in virtual reality, including helping people get familiar and comfortable with the virtual environment, making sure that the visual stimulation does not induce what was referred to as simulator sickness. Earlier virtual environments used to make people a little nauseous because there was a delay between the movement of the individual, their head movement, for example, and the change of the visual cues in the environment. We have already brought 24 people through our study, and we've measured things such as cognitive fatigue, task burden using a standard measure called the NASA TLX, and locomotion, or moving about the space. We are launching a study in the next several weeks to look at the ability of patients to select foods in accordance with the sodium restricted diet. And eventually we'll be creating a household environment to help people envision making their medication decision-making at home. Excuse me. We use a head-mounted display to bring a person into the immersive environment. So there are many approaches to immersive virtual reality. Virtual reality caves is an alternative. We do not use that. We use this set of goggles that you see on the screen here. And in the upper right-hand corner, you can see one of our staff members is helping a person put this on. This device is still rather heavy, and it is somewhat awkward. We don't expect that people will eventually walk around the world with virtual reality devices on. But for now, this device is allowing us to place a person in a deeply immersive environment so we can begin to understand the micro behaviors and the responses. On the lower right-hand side, you see the controllers that one uses. By pressing those buttons, one locomotes or moves through the store. Also, pressing other buttons allows for selecting and dropping off of objects in our in the selection process. This is what our laboratory looks like at the National Institutes of Health. Because of the nature of our studies, individuals sit as they experience the virtual environment, moving through it through a process of teleporting. So they are safely sitting still, but still able to move through a fairly large space. You'll notice that there's 2 what we call towers or emitters that are next to the person's seat. Those emitters help to provide the 3D orientation, making sure that the image that is displayed is aligned with the person's visual field. So if you look across the 3 slides from left to right, you'll see that the person's head is moving, and as their head moves, they see different parts of the virtual environment. You'll notice that the head-mounted device is in place in a way that no light enters this, so the person is totally involved in the environment. And you'll notice that we do always have a staff member in the room with the individual, so no one's in there alone. Now, One of the things that we have tried to do is to make sure that we understand behaviors. In order to understand behaviors, we have to give people a task to do in the environment. We have found that as we give people a task to do, they are much more comfortable doing it if they see indicators in the environment that make the environment look more real. We call those avatars. On the right-hand side of the screen, you see a human, and then you see the avatar of that human. This is an example of something that is an extreme recreation of a humanoid look as an avatar. And we've actually found that going too far, making our avatars too real, makes people uncomfortable. In the left-hand side, I want to talk with you about something that has been known in both the gaming industry and now in virtual reality, and that's called the uncanny valley. The graph you see on the side has two axes. One is familiarity, and the other is human likeness. And as images become more familiar, people become more comfortable with them. As images become closer to a human, looking like a human, people become more comfortable to a point. And then if the avatar's image becomes too real, it gets uncomfortable for the individual. They call that the uncanny valley. That is, the virtual space looks too familiar and it causes a distress in the individual as they're in the environment. So when we're trying to use virtual reality for nursing research in these ways, we want to make sure that we create environments that are acceptable and useful to people and not frightening. Our measurement challenges are not insignificant. As I've noted, that people are not actually walking. And when we want to understand where they are, we need to understand, as you see on the right-hand side, where an individual is in three-dimensional space. So understanding their location, which way are they looking, and how much are they moving are our three first challenges. And we're able to study this very precisely, but we have to study it in a meaningful way. We also look at things like behavior. How much do people explore an environment? Attention, where do they pay their attention? And what their own experiences are, including, did they feel like they were actually in an environment? Understanding movement has been the focus of one of our key works in our first year here. And if you look at the lower right-hand corner, you'll see the trajectory that one of our participants took through the store. That is, they walked up and down aisles, returning to some aisles, and spending only a short period of time in other aisles. In order to understand movement, we've looked at the excursion, the amount of distance people have made. We've looked at reversals, how much do people turn around? And we've also looked at stationary moments, how much do they stand still and actually look at an object, as you see in the center here. These are very important aspects of understanding human behavior in a virtual environment because they help us understand the correlates of choice. So if I'm looking for a particular food object, do I wander through the store and do I get distracted, or do I go directly and search for that particular object? Our use of virtual reality is helping us to understand the micro behaviors of self-management. How does immersive virtual reality support nursing science? Well, fundamentally, we believe immersive virtual reality enhances the relevance, the rigor, and the reproducibility of nursing research. Because the environment is fixed and standard, we're better able to understand the clinical and human experience of a person in context. But the environment also allows us to have very precise measurement, perhaps much more precise than we can have in a physical world. And we can recreate the exact experimental conditions over and over again. This gives us a much more stable environment for research. Now, virtual reality has the capacity to accelerate bench-to-bedside translation, and we're excited about these clinical applications that we see now and in the future. As we look to the future of using virtual reality, we look to see where images make a difference. Here are three that you may come across. First is exposure therapy. We found for people with psychological disorders, particularly fears, that exposing an individual to high places or being in front of an audience in virtual reality is a safe way to do that exposure therapy. We found that people can rehearse complex care activities in a virtual environment and then transfer that learning to a real environment. We also are beginning to see applications of what we call aided visualization. If you see the patient on the right-hand side, superimposed on that patient are the coordinates that were gained through an imaging study, now precisely placed on the individual, which would help in surgical planning. We envision immersive virtual reality moving out of the laboratory into the community as devices get less expensive and easier for people to use. We have a project going on at the NIH right now where cancer patients are sent a virtual reality headset that gives them a relaxation experience to manage their anxiety during chemotherapy and in between visits. We do recognize that one of the challenges of virtual reality is that data generation is enormous, and enormous amounts of data, billions of data points are generated with each study. So selecting which are most relevant to be acquired and organized and preserved is a very critical research task that we've taken on here. As we look to the future, though, we look to learn from other parts of research, other scientific groups. And now I want to take my last few minutes to talk with you about how the National Library of Medicine is actually helping us with that. The National Library of Medicine in the United States is almost 200 years old. It is the primary nexus for literature and genomic data sharing for the world, mostly electronic now. And it has particular features that help to support advancing virtual reality in nursing research and practice. In our history at the National Library of Medicine, we have begun from being a bookshelf in a field army hospital's tent in 1836 to 2036, envisioning a future of the 21st century library where data science accelerates discovery, reaches scientists and society with trustable information. In the period of time between 1968 and 2000, the National Library of Medicine benefited from the enormous digitization of the world. But importantly, the visionary leaders we had saw that this should not only be for scientists, but for lay people around the world. So we have a vast network of health information that provides people in everyday living in almost 35 different languages help with their lives. We conduct research, and we also support the analysis of data. Our strategic plan right now has three goals: accelerating discovery and advancing health through data-driven research, reaching more people in more ways to enhance dissemination and engagement, and building a workforce for data-driven research and health. My personal research focuses and is supported by that middle pillar, reaching more people in new ways. I envision a time where reading becomes only a part of the way we understand knowledge, and visualization, whether it's visualization of an experiment or visualization of a physiologic process, helps people understand and can better experience the knowledge they need for taking care of others or taking care of themselves. The National Library of Medicine is probably best known through its products and services. PubMed and PubMed Central, our two literature databases, are particularly widely used around the world. PubMed has over 32 million citations in it right now. It's a huge amount of data. We'll talk about how we're making that more accessible in just a minute. Our biological and genomic databases are also listed here, the SequenceRead Archive or GenBank. ClinicalTrials.gov is an enumeration of over 300,000 clinical trials, many of them actively recruiting, and over 50,000 of them have results reporting. So the National Library of Medicine provides a platform for dissemination of information about nursing research, and also helps nurse researchers plan new studies by being able to evaluate our clinical trials repository. At the NLM, we have high-value genomic databases. We also focus on using common terminologies, health terminologies and standards, and important and relevant to nursing, of course, would be the terminologies such as the nursing intervention, classification, or nursing diagnosis. We also have been using machine learning to cluster clinically meaningful indicators so that when an institution, a hospital wants to determine is a patient really getting improving in their diabetes self-care, we can bring several different variables together to provide a composite score. We serve millions of people 24 hours a day, 7 days a week. We have over 15 million accesses a day to our resources, many of them by computers, but many by people. We also support, and during this time of COVID, sequence-based public health strategies to make sure that we can understand the biological basis of illness. We use standards to help make data fair and promote access to controlled data sets, that is, making sure that people are properly authorized to see data sets. And we conduct research to define and develop new ways. Here's an example of some of our research. I mentioned we have 35 million citations in PubMed Central, and it's really hard when you do a PubMed search to actually get the ones that you find most relevant. But using machine learning and artificial intelligence, we take the search strategy that resulted in a series of hits articles that you might find useful, but then we apply a special learning to rank algorithm that gives the best match to your query at the top of your search list. We've learned that providing people with 10 or 20 pages of citations in a search is actually not helpful. Most people don't go past the first or second page. So we want to use artificial intelligence to bring these forward. We're now using some of the same machine learning that decodes images to make sure that we're bringing the proper articles with proper figures in them to the attention of our readers. We also work in the community in the clinical practice area. Nigam Shah's work has applied artificial intelligence to provide in-the-moment consultations to help understand how does my patient look like other patients we've taken care of. So bringing together the wisdom of librarians, clinicians, data scientists to understand what treatment next steps should be taken for this individual is one of the ways that the National Library of Medicine brings literature and clinical records together for care. We also leverage public resources such as Google Street View to better understand the social determinants of health. By using the zip code of the individual, we're able to help clinicians see the community, the amount of walkability, the access to grocery stores that might be important to helping a person achieve their care goals. Because of the changing nature of research across the NIH campus and the world, we understand that improved design, increasing the acceleration of informatics applications to clinical research, particularly language and terminologies, is really very, very important for the next few years. But fundamentally, the bottom bullet, we must engage communities in design and implementation of research, because community-based growth is where nursing needs to be going. We see a change in scientific communications, micro-publications or early publications, presentation of data as a publication in itself, but importantly, in innovative presentations of smart research results is what we'll see happening in the future. I'll close by commenting on health data standards. These are primarily English language standards, but they ensure that data generated in one clinical setting or in one study can be compared to or comparable to others. On the screen in front of you, you see a number of key terminologies. The MESH terminology, which is a medical subject heading. SNOMED is clinical terminologies. SNOMED is used globally. RxNorm is a medication or pharmaceutical terminology. LOINC is a laboratory study. VSAC is an accumulation or a linking together of terminologies that make it more appropriate to describe a patient holistically. And FHIR is a message standard, sort of like the address spacing on an envelope, where you get familiar with which piece of information goes in which order. Supporting terminologies and disseminating them is a critical role of the NIH. The growth we need at the National Library of Medicine is to develop standards and terminologies to describe visual cues and visual experiences. And I believe in the next few years, we're going to be seeing greater characterization of things such as walking or motion or the emotive context between a patient and a family member. The National Library of Medicine invites you to join us for the future to think where visualization can take us for global health information. Where can we go? What can we do? And how do we do this together with you? I close by reminding you that our fundamental commitment is to provide trusted information, algorithms, and visualization to the world. And I encourage you to contact me if I can be of assistance. I post a blog every Wednesday morning. Sometimes it describes activities specific to nursing. Sometimes we bring in colleagues from across campus to tell us what's going on in their activities. My email address is on, and I'm active on Twitter, so please reach out.